Hello, everybody. This is James Wynn with the Ree Wynn Foundation, and this is our new podcast, the TTP Warrior Podcast. We're going to be talking to TTP Warriors every week. Sometimes it'll be patients, sometimes it'll be caregivers, sometimes it'll be doctors or researchers. But today is a very special day because this is our very first podcast, and we have Miss Anise Banks, who hails from Tennessee, and she is a TTP warrior. She's a patient. She's been diagnosed with TTP some time ago, and she's going to tell us a little bit about her story, and how she contracted TTP, I guess is the right term, and maybe it's not the right term. Obviously, I'm not a doctor, but she'll tell us a little bit about her story. How you doing, Anise?
Good evening. I'm good. How are you?
Doing well, doing well. You probably shouldn't say evening because then they know when we're taping.
Oh, okay.
No, I'm just joking.
I was like, we want to act like we taking this in the morning.
Well, Anise, so a lot of people don't know what TTP is. So do you want to take a stab at the super long name, or do you want me to do it?
I can take a stab at the super long name.
Okay.
It is Thrombotic Thrombocytopenic Purpura.
Awesome. And essentially what that is that's a disorder where blood clots form in your body. It attacks different organs, and it could be highly fatal if it's not caught in time. We do know that. And the only treatment for it right now is really blood plasma transfusion or plasma exchange. Well, I shouldn't say the only treatment because there are some medications out there now, but the most effective treatment is still plasma exchange. Is that correct?
Correct.
How did you know you had TTP? What was your journey like? How did you get diagnosed?
Well, it was a long journey. I didn't know I had TTP. I was just started all of a sudden bruising, started getting really tired, starting having neurological symptoms, really bad migraines with numbness, and feel like I was having a stroke. And so I just knew something wasn't right. So I started off going to my primary care doctor, and he had given me a call. His nurse had given me a call and said, "Hey, go to the emergency room. Your platelets are 34,000." And so I went to the emergency room, and they referred me to my oncologist, hematologist, which I already had one from a prior diagnosis of a rare cancer, a neuroendocrine carcinoid tumor, which was on my appendix, which I had to get. It was eradicated through surgery. I had a right hemicolectomy, so it took out half of my colon. So I'm a semicolon. Y'all catch
You're a
that joke?
semicolon.
I'm a semicolon.
That's kind of cool.
Yeah. So I already had that doctor, and so from there we began testing. He didn't know what was wrong. I remember prior to this diagnosis asking him why I was bruising easy. He was like, "There's no way that you could develop any kind of hemophilia or anything at 35." So, okay.
All right. So wait a minute. The bruising gave you or the doctor thought that maybe it was some type of hemophilia, or
I thought maybe it could be some type of hemophilia because I have my grandmother in my family, they have the von Willebrand clotting disorder. It's in my
okay.
family. So, and some of my aunts and cousins have it. So I wanted to be tested for it because I thought maybe that could be a reason why I was
Bruising.
bruising. And we all know, people in the TTP world know what the von Willebrand cleaving factor is, and how that has to do with us developing TTP. And that it cuts that the item CS13 cuts the platelets, the von Willebrand. I can never say it right.
Von
Cleaving,
Willebrand.
yeah, Willebrand.
Yeah.
Cleaving, it cuts it, but with TTP, the deficiency is so it doesn't cut the platelets. It doesn't cut it for it to clot. It doesn't cut it small enough so it clumps together.
Mm-hmm.
So I asked him, he said, no, there's no reason why. So did some tests. They came out kind of normal. But leading on back to me getting diagnosed, I was in the emergency room weekly for about a month because I was having mini strokes, but they were telling me I had hemiplegic migraines. My doctor didn't know what was going on. He tried some steroids that didn't work. My platelets continued to fall. So then he decided to misdiagnose. So then he decided to do a bone marrow biopsy. And with that bone marrow biopsy, he told me that it was normal when we got the results. I remember that day like it was no tomorrow. We went back into his office to get the results, and he said, well, your platelets are 13,000, but your bone marrow, so they dropped, but your bone marrow biopsy is worse. I mean, well, your bone marrow biopsy is good. There's nothing wrong with it, which was not true. There were symptoms that showed, we'll say results that showed that it could be TTP in the biopsy. So he misdiagnosed me and said I had ITP, put me on rituximab. I took one infusion of rituximab the next day. And after that infusion, I wasn't good. I just remember also crying to my doctor saying, hey, I feel like I'm dying. I had a migraine. I wasn't myself.
Right.
And
can we back up just a second?
Yeah.
You first said your platelets were 34,000.
Yes.
And then you said they were 13,000.
Yes.
That's a dramatic drop by itself. But what should the platelets be for everybody that's out there listening?
Your platelets should be anywhere from 350,000. It depends on your lab scale, but more likely 400. We'll say 400, 350,000, 400,000 to 150,000.
Okay.
100,000.
So under 150,000 is really bad.
Yeah, that starts questioning. Hey, doctors will monitor you. A lot of times they probably might do nothing with it, but that's when some doctors will monitor you. But my platelets were 34,000 to start. And they dropped all the way down to 13,000. I remember I was having a bad migraine, the worst migraine of my life that day, crying to the doctor, asking him to admit me to the hospital. He said no, he didn't see any merit for it, but I thought 13,000 platelets should have been a merit. But he didn't see any merit for it. Instead, he decided to put me on rituximab. I started the infusion the next day. I still wasn't feeling well, but it went okay. That was on a Wednesday. That I had my infusion on a Thursday. That Friday, I woke up. I was planning to go see my grandmother, who stayed about an hour away with my mother. But I all of a sudden gotten this pain, and so she said, "No, you stay home and put me to bed." She left and went to go see my grandmother. But she said she called back and talked to me, and I was barely responsive. I just remember telling her I threw up. I was in so much pain that I threw up. And she called my sister, told her, whatever you're doing, stop it and go get your sister, call 911 and get her to the emergency room now. I'm on my way back. So my sister came, got me, went to the emergency room. When I got to the emergency room, I had to use the bathroom. And when I went to use the bathroom, my urine was like a black cherry, tarry color. I had to point out that I arrived by ambulance and they put me out in the waiting room. But once I went to show, they asked for a urine sample. And once my sister sent it to the nurse, they got me back really quick. But I still ended up waiting for hours. But they ended up admitting me. The on-call oncologist for the group that my doctor was in, my old hematologist was in, he started looking at my results and looking at the history. He said I meet majority of the markers for TTP, but he needed to do a couple of more tests, and they take a couple of days. But he told my mother.
Did he tell you what those markers were?
Yes, the neurological symptoms,
which is the headaches and
the headaches, the numbness, the stroke, because I was having many strokes. The strokes, the mood changing, the bruising, the purpura. I did have purpura, as well as.
And what's purpura?
Purpura it's purplish reddish spots that develop under your skin, which is just bleeding up under your skin.
Okay.
It kind of looks like a little rash.
Petechiae. Some people call it that. Okay.
Yeah, and it also could be petechiae as well.
Mm-hmm.
And it just also bruising up under the skin.
Wow.
So I look like somebody drove me down from the mountaintop. I could bump a very soft couch and I would bruise.
Wow.
So I had bruises all over me. So I looked like I had got drugged from the mountaintop by that time. The doctor told my mom, it was 2:00 in the morning. The doctor told my mother, I have to start on plasmapheresis right now. I have to do this treatment. If I do not do this treatment right now, by 2:00 tomorrow afternoon, she would be dead. So they rushed in and put an archaic catheter in my leg and began plasmapheresis. I had a couple rounds that night, that night and that morning. Well, still was the morning, but the next day.
Mm-hmm.
After I came back from the plasmapheresis, evidently I was acting weird. Something was going on. My nurse came in. I think she called the doctor. He came in and he was talking to me and my mother, explaining a little bit more about TTP. Next thing you know, all of a sudden my face goes numb and I droop and I black out. And 3 days
So at
later,
this point, had you gotten a diagnosis of TTP?
I have not. He was just suspecting.
He was suspecting.
Yes.
And so the
he had to go ahead
treatment
and start
was,
treatment.
because
said,
we suspected maybe TTP, we're going to give you the treatment for TTP, and then we'll take it from there.
Yes. He said plasma's not going to hurt. He didn't want to wait because I would be dead. He said, me getting the plasmapheresis, even if I don't have TTP, is not going to hurt my body.
Right.
It might probably actually improve it. Either way. So after the 2 rounds of the plasmapheresis or plasma exchange, I was in there. Evidently, I was acting weird, had neurological symptoms, was acting really weird out of it. I don't know. Maybe I guess I was because I didn't know. But
well, maybe you were acting normal. Let's say that.
Yeah, well, I don't know if it was normal, but the nurse came in and she called doctors in, and he came in and he was still continuing to explain to me and my mother about TTP. And again, like I said, my face drooped. And the next thing you know, I fell out. And 3 days later, I woke up in ICU and told that I had a deadly blood disorder called TTP that was not curable.
Wow. And so at that point, you realize you've got something that is incurable. But did they talk about why you needed plasmapheresis or plasma exchange at the time? Did they tell you anything like that?
No, I was out of it. I was not in my right mind. I had a big stroke. So they had called cold stroke, sent me to CCU. Then I woke up. They actually did the plasmapheresis in ICU or CCU. And once I started coming to, because I was in the hospital after that for like 4 weeks. And as I started coming back into myself, I started asking questions. Why am I having to do, what is this? What is plasmapheresis? Why do I have this big catheter on my leg? What is this? To my mother doing the research for, trying to tell me what it is. I'm a medical nerd. I have a medical background. I'm a medical assistant by trade, as well as at the time I was working in a dialysis clinic. So you
kind of knew what some of this stuff was. Yeah.
But I was not familiar with TTP.
All right.
I thought the doctor was like, we're going to have to put a catheter in you. I thought my kidneys had failed. To me, I just knew my kidneys failed. That was in my head. I was not familiar with the cleansing or cleansing of plasma, because plasmapheresis is taking bad plasma out and putting good plasma in. Gotcha. So I was not familiar with that process. I was only familiar with hemodialysis, which is using the same port access, which is taking your blood out and cleansing your blood and putting your blood back in and taking the fluid out.
So when you say taking the plasma out, I do understand that blood is made up of different parts, and plasma is one of those parts. Then you got red blood cells. I'm not going to pretend to be a doctor or any of that, but there are different parts. And In this case, it takes the actual plasma from the blood. Does it take all the blood first and separate it, and then? So go ahead. You tell me what happens.
Yes. So basically, it's a machine, and it takes your blood out. So your blood's outside your body, and it separates in a centrifuge your plasma.
Okay.
And it puts it in a bag, and of course, that's the bag. And
right.
when your blood comes back into your body, it then infuses the plasma, the good plasma, in with your blood, and it goes back into your body.
So this is plasma that someone has donated.
Yes, that someone has donated, and that plasma carries the platelets, and it also carries the Adams TS13.
Okay.
So
you learned this after, but right now we still in the hospital.
Yeah.
We in ICU. You've been in there 3 or 4 days, or did you say weeks or days?
About 3 or 4 days, almost a week.
3 or 4 days. Sometimes in, sometimes out. Not always coherent, right?
Right.
And now you're really starting to dig into what TTP is.
Correct.
What all these symptoms mean: the bruising, the dark color urine, the neurological symptoms. What happened next?
My mother was a catalyst for me. She started the research, and she just would, once I really got back to who I am, she would send me on my cell phone. She would send me different information about TTP, which was far and few. But
what year was this?
This is out. I got diagnosed March 2018. Did not say that part. So this is March of 2018.
Okay.
So there was very far and few information out at that time. My mother was like, this is rare. There's only 1 in 6 per million people who get diagnosed with it a year. And her showing me that there was no information, and just the small information out there and the small patient stories out there. She was my catalyst for me to, one, it sparked my interest to know and try to figure out what is this disease. Leave no stone unturned. You need to know about this. This almost took you out. It could take you out. We don't know what this is, how it's happened, why it started, if it's going to end. Are you going to be able to go back? Your life's going to go back to normal. What's going to happen? I had no idea. So I started turning over every stone that I could. And with doing that, I decided that, hey, I want to, share my story. And I started hashtagging TTP on Instagram. And that's where I've met a lot of other TTP warriors.
Okay. So there's a social media following.
Yes.
Of sorts. Okay. Yes. All right. Now, were you told anything about how the plasmapheresis would help you?
Yes. I had asked one of the techs, the nurses that was the expert, because I asked one nurse and he was like, well, honey, I'm not really the expert, but I'm gonna tell you who you need to talk to. She's gonna be the next person that does your plasmapheresis because she's working tomorrow. So he had me talk to her, and she started trying to break it down a little bit for me, and that's how I learned how the centrifuge, which I was familiar with these machines again and the port access, but I was not familiar with plasma exchange, nor was I familiar with TTP. I had no earthly idea. But she started breaking down what the machine does, what it was for, said something about an Adams TS13. At that time, I did not know, could not understand what it was. Still, it's kind of hard for me to explain it, but I just know I try to break it down a little bit easier.
Use your own words.
The Adams TS13, let's see here. How can we explain Adams TS13?
Let's not worry about the technical terms.
Basically, it's a protein.
Right. But what did the doctors tell you the plasma exchange would do for you? How would that change the state you were in terms of your health?
They just said it's gonna help replenish and help put platelets in. I had several plasma exchange. I was in a hospital for 4 weeks.
Okay.
And I wanted to go home. I was getting crazy. My mama was tired, and my mama and my sister were taking turns staying with me out at the hospital.
Right.
They did put me in the penthouse suite. I did have one of the biggest rooms on that floor.
Oh, well, that's good.
Yeah, they already knew, like, wait a minute, let's put her, because she's gonna be here for a while, evidently. But so I did get blessed and lucky with that. However, I begged the doctor to go home, and he said so he would wait to see if my platelets would drop after plasma exchange. And then he also had me on high dose of steroids. I was on 120 milligrams of prednisone a day.
Mm-hmm.
So he would see how I would do and if I would drop. And so he would gauge if I'm gonna go home from that. So it would be, okay, we're gonna try this for we're gonna stop over the weekend. On Monday, we're gonna see how you're doing. And it came to, okay, no, you can't go home yet.
Mm-hmm.
To one day, a couple of days later, he was like, okay, I'm gonna let you go home. However, you have to be in my office every day at 8 a.m. to take a lab, your CBC, and you have plasmapheresis 3 days a week. But I need to see you 5 days a week. And if your plasma is bad on Tuesday, I'm calling and you're going to have to put an extra plasma infusion that day. So there was a lot of times that during this journey and during this process, I was in the hospital at the doctor's office at 8 a.m., like a full-time job, and I'd not leave the hospital at 5 or 6 o'clock at night from the plasmapheresis, because it's a 3-4 hour deal. I had reactions to the plasma, so they would have to stop it, give me Benadryl, just a whole bunch of other things. So it would be elongated out. The day would be longer, mm-hmm. or the plasmapheresis session would be a little bit longer sometimes.
Depending on what your platelet numbers were.
Yeah, depending on my platelet, depending on if I'm going to react to that plasma.
How long did that go on where you had to go to the doctor 5 times a week? And sometimes twice in a day.
It went on for months. I would say 3 months after I got diagnosed, and that was after me being home, and let alone also the times where they admitted me from plasmapheresis because my platelets were well, actually I had an infection from where they did the catheter, and my platelets were low, that it oozed out and started an infection. But they called it before it became a bloodborne infection. So I would have to get my catheter out, get it replaced, and then the moments where I had to go to the hospital because my platelets would go up, but then they would drop down and I wouldn't feel well. Because during this whole process, I began working a new job, and I was so determined.
That was my next question. How you work when you go to the doctor 5 times a week?
Well, it's funny because the nephrologist that I worked for in the dialysis clinic that I worked for with the nephrologist actually became my nephrologist during the plasmapheresis. Because again,
so you was at work getting your treatment.
Well, I wasn't at work because I didn't work at the hospital, but they knew who I was. Okay. So they were like, they didn't understand truthfully how I worked doing dialysis with the symptoms that I had with my TTP. Mm-hmm. I actually stopped working right before I got really bad because I didn't want the responsibility or the guilt or anything of having somebody else's life in my hands when I'm doing dialysis. Because hemodialysis, like plasmapheresis, which is a type of dialysis, it's life threatening. It's very serious. So you have to take that job serious, and you cannot mess up, because your one mistake can cost somebody's life. And I didn't want that on my hands, and I didn't want that on my judgment card. So I decided to take FMLA, take short-term disability, and figure out what was going on with me, which was a good thing once my symptoms really started kicking in and started getting bad.
Wow.
But they knew who I was, but the process was very long. It was very traumatizing because I didn't know if I was going to live or die. It was day by day.
Right.
and I didn't know if I was going to have another stroke, if I was going to have a heart attack, because the platelets, basically the clotting TTP affects your organs, and it clots in your organs and cuts off the oxygen, and it will kill your organs. Your organs start to shut down. So I didn't know what organ is it going to affect next, because when my initial crisis, it affected my brain and my kidneys and my stomach, actually, because that's why I was having that's also another reason why I was having bad stomach pains, because it can clot your intestines. So I didn't know. It was just a day by day thing, and along with taking high dose prednisone and just other medications.
And prednisone is what, a steroid?
A steroid.
Okay.
That helps boost your immune system. It's an oxymoron, because it's good first, but if you take high doses over a long period of time, it becomes bad. I gained 100 pounds off of it. I was miserable. My joints. At first, I was feeling like He-Man. Then I was feeling like an 87-year-old woman, osteoporosis. That's how bad my joints hurt. So it has good things and it's bad things. And I gained 100 pounds, not gradually over a year. It was.
So you were out of work for a time, and how long was it before you got back to work?
Well, actually, I wasn't out at work for a time. Okay. I was out. I took my FMLA, short-term disability, but during all of this that was going on, I had accepted another job position.
Oh.
Yeah. And so I argued with my mom in the middle of that hematologist office, because she was like, "You're going to need disability. You're not going to be able to work." Yeah. And I'm like, "I'm going to work. This is this is the job I wanted. Like, I worked hard for this job to get this job." Mm-hmm. So the closer it got, I was lucky because they kept on pushing off the open date because of construction. So I got lucky enough to where I didn't, instead of being reporting to work in April, I was able to report to work at the end of May.
And you were diagnosed when?
Yes, I was diagnosed in March.
Okay.
So I called my supervisors, and I was like, "Hey, this is what I got going on. I don't want to waste your time. If you want to hire somebody else." And they're like, "No, you come in for training. We're very lax. We're not letting you go by. Your resume is too impeccable. You were too impeccable. Your interview scores were too high." So they, worked with me. We'll work with you. Mm-hmm. And I was like, "Well, she was like, we'll treat you like Michael Jackson, put a mask on you. You come on in." So I went into work. For about a week and a half, I went to work, and I tried to work. But they looked at me and they were like, the doctor, because I was working with nurses and doctors, and my supervising nurse was like, "You look white as me. Are you okay?" And I'm like, "Why are you looking at me? I'm fine, And the doctor said to me, "You don't have to come to work on Monday." Like, she knew, like, this is not good. So
they could tell something wasn't right.
Yes. So I had went to my hematologist, oncologist. He sent me to the emergency room 2 days in a row for them to admit me. They finally did admit me because my platelets went up. They would go up, but they'll fall right back down because my TTP was refractory, which means that the treatment, just the plasmapheresis, was just not working, and the steroids just wasn't working good enough.
Right.
I need a little bump. And so from there, I was blessed because I tried to resign and they would not let me resign. And I was blessed for working for 2 weeks that they put me on short-term disability for 6 months. So that was a blessing.
Mm-hmm. Absolutely.
I don't know. I just that was a blessing. I was lucky, or like I like to call a blessing.
So you were out of work for 6 months?
Yes.
What was it that kind of turned you around, that helped you to get better, so with lack of better term?
My doctor, my new hematologist oncologist, the other one had retired that was about to kill me. The one that said everything was fine and just didn't want to listen to me and wanted to do what he wanted to do. He was about to kill me. So I had a new hematologist oncologist. And he admitted he was very humble, and he admitted he doesn't see this diagnosis much.
Mm-hmm.
A classic case. He's seen drug-mediated TTP, people with those kind of symptoms, but he has not seen a classic ITTP or ATTP case. He doesn't see those. And so he called his colleague at Vanderbilt. Colleague contacted a doctor at Vanderbilt, and she told him what to do, basically. And she told him to put me on rituximab, which is a immunotherapy, chemotherapy, and that was the process, the slow process of me getting better. Now, I had to taper off of the Rituxan as well as taper off of the prednisone. And what they don't tell you when you taper off prednisone, even though they taper you off, they don't warn you or treat you or tell you about the prednisone side effects. It's in the withdrawals. It was horrible.
What were some of the side effects?
Achiness, just, anxiety, which my anxiety was up anyway because of everything that was going on, but just the achiness, the rapid heart rates, just different little things that were happening on top of me taking rituximab. And those could have been some of the symptoms of that. Side effects of that drug as well. The hair loss. They don't tell you about
hair
that.
Loss.
Yes. Your body
well, it sounds like a lot of the same symptoms as somebody going through chemotherapy.
Yes.
It's similar to that.
Similar.
Wow. Now, what about you? You said you had a lot of anxiety, and there's not many people. Even the doctor said they had never seen the cases or hadn't had many cases. Is there a community of folks on TTP? I know you said you saw some people on social media.
Yes. I ran into some people on social media, as well as I found the Ree Wynn Foundation. And that's where I started also to link. And the Ree Wynn Foundation, Miss Vicky, may she rest in power. She gave me a platform, and she also helped me feel like I wasn't alone. Even though me hashtagging and talking to other people, that also made me feel like I wasn't alone, and started the community of just the people I know. And I realized that women that look like me, we all had the same story, that 12th hour to live. Nobody listened to us, and we almost died, and it was traumatizing. The PTSD, the anxiety of day by day, the anxiety, the PTSD, the trauma from the diagnosis, the symptoms, and the treatment. Trauma.
So you said women that look like you, this TTP affects primarily African American women.
Yes, ATTP affects primarily African American women, or primarily women of African descent. We're 7 times more likely to develop and get diagnosed with ATTP.
And also more likely to have a relapse.
Yes.
Have you had any relapses?
I had a relapse right after I got diagnosed. They put me in clinical remission in September, December. They were like, okay, you're out of remission, which clinical remission means your ADAS-CS13 is over 20%. I went back, my ADAS-CS13 was 10%. So I had to get back on rituximab, which then the Vanderbilt specialist had told me and told my doctor, this was keeping me falling off the cliff, to be on rituximab every 8 weeks for almost a year. That was me not falling off the cliff, because they felt like with me having my ADAS-CS13 being low, under 20%, that if I didn't take the rituximab every 8 weeks, that I was going to fall off the cliff. So it was like they were holding on to me. I'm leaning off the cliff. They're holding on to me like, no, we're not going to let you fall. So I was blessed enough to have my first initial hematologist oncologist after the bad one. the one who did the diagnosis.
I saw the eye roll.
Yeah, because he almost killed me. And he was right.
Okay.
We can scratch that off. But yeah, he did. After him, that he was humble enough again and knew and did not lead with his ego to say, I don't know what I'm doing. And so he had somebody come in who's actually an expert. This is what she studies. This is what she does. She's more familiar with this disease. Because again, this is a rare disease and a doctor is lucky to treat two. That's just a regular hematologist oncologist in a 60-year career. They're lucky to treat two people with TTP. So there's a lot of doctors who do not know about this disease and treat this disease even now in archaic ways and don't listen to their patients. Because I talked to warriors who weren't blessed enough to get that specialist.
Right.
So they're in what we call a TTP desert. These doctors don't know. So they just going off of something, an old book or something that's published or something they knew in medical school. So I was blessed enough to have my doctor get me with her, and she decided that this is the diagnosis, the treatment that I needed, and it helped me to get my Adams CS13 up to where I would not have any more relapses. At this time, fingers crossed, we've been good. I've dropped one time, I had COVID. It dropped, but my body was able to rally itself back up, and I did not have to have plasma rituximab.
So how long has it been now? Are you still on rituximab?
No, I'm not on rituximab.
How long you been off that?
I've been off rituximab since 2021.
Okay.
Due to the side effects that I were having, me and my doctor decided at this, I'm good, my platelets are good, that we can pause it. The deal is, if my Adams CS13 drops, then I do have to get back on it. Me being back on it every 8 weeks, do not know. But if it drops, I know I would have to do the initial 4 weeks, which is one infusion each week. So it would be initial 4 infusions.
Right.
So if it drops again, I know I will have to get back on the Rituxan. If it drops, we don't know, or I'm lucky that my doctor has me on a 3-month regimen of testing my Adams TS13 at this time. He titrated me down from once a month to we're at 3 months, and he's gonna keep it at 3 months, but I don't have to see him but every 6 months. Maybe after this, could be every year, but I still have to do my Adams TS13 every 3 months. If I do develop TTP or if I have any symptoms, I have a standing order. I can always go in and get my blood test drawn.
So right now you have no symptoms, no bruising, no
I have bruising.
Urine. You still have bruising.
I still have bruising.
Okay.
I still have bruising. I still have neurological effects from the TTP, from the stroke, the brain fogginess, forgetting my sentence or forgetting what we talk about in the middle of having a conversation. I also developed clots in my hips, which killed my hips, which is osteonecrosis, and I had to have 2 hip replacements. So I have 2 hip replacements now. Yes. I have 2 hip replacements now.
So TTP affected you in a number of different ways.
Yes,
that is still affecting you cognitively and some physical.
Yes, I still have bruises. My body aches. I call them like flares, to where I can bruise, I can have neurological symptoms, but my platelets are still good. Everything's good. So I don't know. There's something missing that doctors are missing, because my symptoms and some of the things that I'm having are, again, the other warriors that I talk to and discuss. We go back and forth talking about.
So when you keep referencing other warriors you talk to, when do you guys meet? We meet.
Well, I meet on the Ree Wynn Foundation. I meet with you guys in your group. It's your group meetings,
on the support
group support once a month, as well as I'm always a DM away, and I'm always a DM away. I'm always a text message away to my other warrior brothers and sisters. I like to say that we are related. We're not related by bloodline, but we're related by blood. And I'm always a DM away, because I understand the anxiety, I understand the depression, I understand the PTSD, or overstand it, actually, that we go through. And so I'm always there any time of the day, any time of the night that they need to talk, because we don't have that. and we feel that we're alone, and we feel like there's nobody.
Mhm.
And I don't care what you go through. Cancer patients, I can't identify, well, I can with my cancer that I have, but I really can't because I didn't have chemo. So I can't identify with a patient that has gone through chemo, a cancer survivor. I can't identify with somebody who has lupus or any other kind of disorder or disease. I can identify with them, but I can't identify with people who have TTP. Now, I
Mhm.
can have empathy and compassion for those other people who have other diagnoses and understand it, but it's just something, that camaraderie, that understanding that we go through that nobody else goes through. And I think
Mhm.
that people with other diagnoses feel the same way.
Right, right. Now,
So
the Ree Wynn Foundation is doing an education day at Duke University, November 29th, 2023. Part of the reason we're doing that education day is to do exactly what you said. We're not only hosting the education day for patients or warriors like yourself, we're hosting that education day for doctors to help teach doctors about the symptoms and the latest treatments for people with TTP so that people can get diagnosed quicker and they don't have the terrible story that you have of, you know, taking long to have a diagnosis, having a misdiagnosis first. Of course, you know, it's unfortunate that we hear so many times people being misdiagnosed and having surgeries or different things happen to them, and that never had to happen because they had TTP. So one of the last things I want to ask you is, what is it that you feel kind of keeps you going? Because I see you being really strong, but every now and then I see that turn in your face. This is not an easy thing to talk about. It's not an easy thing to relive. What keeps you going? I know you talked about your support group, but what else is there?
giving back, paying it forward, being a
Hmm.
trailblazer in TTP, saying I'm going to be an advocate, I'm going to be a patient advocate speaker, I'm going to let it be known, I'm going to the rooftops and hollering and telling any and everybody about this disease and trying to explain it in layman's terms, being there for other TTP warriors, new ones, old ones, being there for them, because again, this is traumatic. Um, that's what keeps me going. Being there for our community. You know, health equity is my passion,
Hmm.
and being there for that, because doing this, I realized that even though that healthcare access is there, that's equal, but the
Hmm.
equity is not there because I'm getting archaic catheters put in me. I'm getting doctors not listening to me. I'm getting doctors telling me that I'm perfectly fine. And even now, with some of the things I have going on, everybody's so scared to treat us because they don't know about TTP. They're scared we don't get clinical trials. We don't, you know, there's a lot. So I'm
Hmm.
pushing for this. I'm pushing to say, hey, we're here and we're being left over here to suffer, and we shouldn't have to suffer. I'm pushing for a good quality of life. I took what TTP tried to strip from me, because it tried to strip a lot from me.
Hmm.
It took my dignity, it took my confidence, and I had to rebuild all of that because I had to fight a war. When I looked in the mirror when I got diagnosed with TTP, I looked at a shell of me. I looked at the TTP, the leftover shrapnel that was from this war that I had to fight with, this disease that's in my body that's constantly trying to kill me even at this moment. I'm
Hmm.
winning right now, but I don't know the day that I can't win no more, that my body's so beat down it can't fight anymore. Luckily there are diseases, there are doctors, I have a good team, and luckily there are treatments that are going to help me from that. But I want to be able to say, hey, I can go to these doctors and they're going to know about it. I don't have to explain it to them. I don't have to get an attitude. I don't have to get, I want them to be able to understand what TTP is. So that's what drives me. It drives me to be positive. I changed the acronym to trust the process, trust the progress, trust the prayer, triumph through pain,
Hmm.
triumph to prosperity. Because at the end of the day, my life has changed. I'm not going to be the same, but I choose to take it and thrive. I choose to thrive to prosperity. I choose to thrive and be thankful and think the positive that this is not the end. This is not the end.
Thank you so much,
TTP is not
Anise.
that. So that's what pushes me, is just to be positive and to give back to my community.
Awesome. Well, we're going to take this video. We putting it on YouTube. We hoping that those inspiring words that you just said helps inspire someone else. The Ree Wynn Foundation, of course, is here to help TTP patients. We have our support groups every month. We have education days. As we said, we're going to have one at Duke University. And then also something else key that you said, you weren't able to work for a period of time. I imagine that at that time that, you know, even though you did receive some support through temporary disability and things like that, but it probably wasn't the same. The Ree Wynn Foundation is now has a emergency support program that provides emergency assistance to people with TTP who live in the U.S., who have a diagnosis or are the caregiver of someone with a diagnosis and they have a financial hardship. So you could just go to our website, www.rewin.org, and you can apply for the program. And we've got funding from Sanofi, which is a pharmaceutical company. They've provided some medical funding grant to us in order to allow us to do this funding. And we've got the South Jersey Foundation, which also provided us with a grant to help us provide this funding, and a number of individual donors who have come out and put their money where their heart is, so to speak. So that way we can help take care of more TTP patients. But I thank you very much for taking your time and sharing your story. And we hope that you continue to not have symptoms, and we hope that your numbers stay good so that one day you can stop taking all those tests and lead a quote unquote normal life. Thank you very much, Anise, for coming on.
Thank you for having me.
All right.
And thank you for the Ree Wynn Foundation, and thank you for the support and the assistance. That's something very much needed, and that's going to take a lot of some of the stresses that we face of how things are going to get paid. Because again, this is a traumatic disease, and so some people don't have resources needed or support behind them needed, and so this is very much needed. And I thank you for all that you guys do at the Ree Wynn Foundation. Y'all are phenomenal. Thank you.
Thank you.